Okay, hi guys. I'm Aquilas and Julie here from CBM-Global. And in this presentation, we are going to take you through the development of theory of change. How can you use this to think through issues like risks, sustainability, and your approaches? And then from this start to develop up a log frame. Have a look at our previous videos where we have talked about good approaches to preparation and consultations. Okay, so what we are going to do in this presentation is show you an example of a design process. And we've moved that from the consultation through to developing a project log frame.
So the example we're going to use is this. We're going to work in an area called West District. And we've got an idea that's been approved for a community-based inclusive development project, a CBID project that's going to focus on supporting an existing OPD, a local OPD, to do advocacy to the local government. So that's part of our idea, because we want to increase the opportunities for people with disability. We know from our consultations that people with disability and their families are quite poor and marginalised, and there's a lot of stigma and discrimination.
And we want to find out what more can be done. We are fairly open-ended at this stage, but know that there's an OPD that could do more with government. All right, so we are going to do some consultation. So we've developed our stakeholder engagement plan earlier. Remember that?
Yeah, so have a look at our previous videos for that process in detail. So we're going to do some wider consultation with people using a few different consultation methods. We're not going to go into great detail about that here. That was covered in the last presentation, but let's just pretend that from that we've asked, what are some of the problems?
We've gathered everybody together and we've used some of those mapping processes to understand the problems. And this is what we are hearing. So let's read them out.
So, well, I'll take the first row and then you can do the second row. So the problems that we've heard are local government doesn't know anything about disability. People think that people with disability are cursed. The OPD is weak and doesn't have many members. People with disability are hidden.
Families with disability are poor. Some people with disability can't earn income, no pensions. Motorbike accidents cause disability. Kids with disability miss out on school.
The government has some disability policies, but not much budget to do anything about it. People can't get assistive technology or devices. People with disability don't have things like smartphones. The carers are worn out, and people with disability and without disability don't know anything about disability rights.
Okay, so those are the problems. So when we ask, well, what about some of the solutions, ideas that came out of the consultations? And so here are some of the solutions ideas. Talk to the local government. So that is one of the solutions. Talk to the local government about disability budgeting, help to get social protection. I'm reading across the top, improve access to assistive technology, help people with disability get new skills, build a factory where people with disability can work, use the CBM savings model for people with disability, do a road safety campaign, work with schools or more kids with disability can attend.
What else? Make local government more aware of disability, work with religious leaders, help people get assistive technology, give out smartphones, pay carers to look after people with disabilities, get more community awareness on disability rights, use learnings from recent work in other projects to help the OPD get stronger.
Okay. So we've done the consultations. So we've got a whole lot of ideas. What are the themes emerging?
So this might have come out of your bigger consultation. So then what you need to do is kind of boil it down. So you might thank everybody involved in those different consultations for their input, talk about how the smaller project implementing team is now going to look at this range of problems and solutions and make some decisions. Make sure you tell people that we're not going to be able to do everything, but we will report back on what we've decided and why we've decided to do certain things and not others. So that whole process of reporting back once you've consulted with people is important.
And so then you might move to a smaller group to think about all the things that we are hearing from the consultations. What's going to be possible? So then you might color code or group things thematically, like here. So we've got in the brown color that you can do with the government. In the blue color, these are things that you can do with the communities. In purple, you've got things you can do with livelihoods, with people with disability. The pink one is about schools. Then the green one about OPDs. So you're grouping this, and in some ways, this is where the dance begins with the partner. This is the co-creation. With the people that you're working with, you've got to work out, okay, we've got all these great ideas. What's gonna be possible? What's gonna work?
Yeah, so it is like a dance, you know. So it's like,
Mm.
what do you want to do? What do we want to do? What do we have the budget for? What do we have the expertise in? So it's that dance, and that's why it's important to have had those conversations right back at the start before you even start working on kind of formulating this project plan about what are the partners' expectations and what are our expectations. So then you start to decide what you can and can't do.
Yep. So you've got all these solutions, you've grouped them, but there's some things that you're not going to work on. So you cross these out. Good ideas, but not for us. For now, you've got an idea that you're gonna work with government, you're gonna help the OPD to do more advocacy and get stronger. You're gonna change community attitudes, you're gonna help improve people's income. So from the consultations, it's starting to develop up. So now with your smaller group, it's useful to develop a theory of change. And often people are quite scared when they hear this phrase, theory of change. And sometimes I hear, do we have to do one of these when we fill out the forms? But my question
Yes,
is,
oh, do we have to do one?
yeah,
But often my question is, well, how
yeah,
else how else are you going to coherently think and agree on what you're going to do and
yeah,
what you're going to achieve and the pathway? That's important. So here, so I'll just read out the things that we've decided we're not going to do. So we're not going to do a road safety campaign. We're not going
mhm,
to build a factory where people can work.
mhm,
We're not going to pay carers to look after people with disabilities or give out smartphones. And we've decided we're not going to work in schools to improve the attendance of kids with people with disability. So we can't do everything. So those are the sort of things. So that's why it's important to be having those discussions about what you can do, what the partner's expertise is as you develop up that theory of change. So this is what we're going to do now, and this is an example of how you could step step things through with a small group with your stakeholders. So what is the theory of change? As Aquila said, often people are like, well, we're not really sure what this is, and it feels really confronting. But basically, it's a theory that says, how is your product or your approach or your service going to help change a particular problem or a particular issue or a situation? So it's not going to be linear. There'll be sort of lines crossing over things. And often it's easier done by hand than with predetermined boxes. I don't know about you, Aquilas, but if I get a template for a theory of change with all the predetermined boxes, I find that very hard to work with. I think it's much more useful if you just kind of hand draw it. And so I would say don't use a template. And then where it is really useful is when an evaluation comes into town, because then a project team can give a theory of change to an evaluator and say, look, this is what the project was trying to achieve.
Yeah. So a log frame is also a theory of change, but what we are going to do is kind of start with something that is a little bit more messy.
Yeah.
Yeah. So use this process to develop a hand-drawn theory of change with the main people, your main partners who will be implementing the project. So remember, your main partners will be implementing the project. You don't do this with a huge group. You do this with the main players who will be implementing the project.
Yeah.
Will be implementing the project, sorry.
Yeah, the ones that will be implementing it. And one of the ways to think about this is, like, how would you communicate the connections between the different things that you're doing to somebody who doesn't know, who's not involved in the project, like this lady who's selling pineapples? Would she be able to understand what you're doing? Would your would your mum or your dad be able to understand what you're doing or what the project's trying to achieve, to show how things are connected?
What are the short-term things, and how will they lead to the longer-term things? Yeah, what are the first things that need to be done that will trigger other things?
Yeah, exactly. And what I find quite useful if you start, because often people struggle, like, oh, where do we start? And I find it useful if you start with like an if statement. So if people are more aware of disability rights, then blah, 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 blah. So then you can use this as a bit of a draft to develop up your theory of change. And I'm going to show you how to do one next. And then to develop up a draft that you can amend and look at before you start to bed down your project. But you do this with a smaller group. You don't do this with 30 people. You do it with 6, 8 people, something like that. And you need a blank wall and some sticky bits of paper, or something like the online Miro boards, if you're doing it virtually. But, marker pens and bits of paper are the best thing. Okay, so let me show you this one that we developed as an example with our Kenya colleagues, thinking about this CBID project idea in West District. So we've got some idea of the problems and the solutions. So let's go. So what we started by saying, if we build local OPDs, organisations of people with disabilities, and if we build skills in advocacy and organisational systems, and OPDs raise awareness about disability rights and stigma and inclusion, and if people with disabilities are supported to improve their livelihoods, so the 3 things down the bottom, then we can kind of make an assumption that will lead to OPDs increasing their membership they'll get stronger. And if we raise awareness, then that will lead to, hopefully, communities changing their attitudes to people with disabilities. So if we're involved with partners involved with the OPD, raising awareness about rights. And then if we think about doing those two things, then local government will probably take more action on disability. And then if the local government take more action on disabilities, then they might give the OPD more formal recognition and they might get some funding, particularly if the OPD has a strong membership. So you see how you're developing up this kind of pathway. And then if the OPD gets stronger, then we can assume that they can get the local government to help people more to get access to social protection, pensions, and to assistive technology and devices. And then over on the other side, if we help people to improve their livelihood, people who are disabled to improve their livelihood, we can assume that people with disability and their families will be less vulnerable to economic poverty. All right, so that kind of makes sense. So, that all sounds pretty rational. So you do something like this in a workshop and you're allowing time for discussion and to move bits around. That's why it's good to do it on a wall. Mm-hmm. Okay, so if people have more access to assistive technology, well, they're going to be more involved in community life. They're going to be less vulnerable to poverty. So that means they're going to be able to hire a taxi to get to a community event. And when they get to a community event, they're going to be welcomed and they're going to feel like, they're not discriminated against. Mm-hmm. And the event will be accessible. And if the OPD obtains formal recognition and people get access to social protection and to assistive technology, then one of the higher outcomes of the project approach is that the disability movement will be stronger. All right, so that all sort of makes sense. All right, so that's what we've got. So let's check our assumptions. So, Aquilas, will one thing lead to the next? This is the sort of thing that you can do in a workshop. Are things really going to work this way? Are there assumptions that are too unrealistic? Mm-hmm. Are there things that might not happen? Are we hoping that there's going to be too much magic involved and not enough reality? So it's a chance to do a reality check. So here, one of the things that we discussed here was that local government is going to take action on disability. And then it comes up in discussion, well, I don't think local government is going to take action on disability if the district government isn't involved. So we change our theory of change a little bit and we add in the district government to make sure that they're included as well. And also here, see, we've changed these higher level things. So we've said the disability movement will be stronger in West District. It's not going to be stronger throughout the country. So let's be more specific up there. So we write, people with disabilities have a better quality of life in West District. And we write, the disability movement will be stronger in West District. And we've also said, okay, by adding in our work with district government, that's probably going to make our change theory or our project logic more coherent. Yep. So, okay, that looks a bit better. All right, I'll just take the lines out from now on so it doesn't look too messy. Okay, and then right at the top, you've got what we call the overall objective of the project. So we've written that here, that people who are vulnerable will have a better quality of life. So that's people with disability. Okay, so the kind of thing, Okay, that looks okay now. So now what you can use is your draft theory of change to go through and look at specific issues, like, for example, risk. So let's start with risk. And this is a useful thing to do in a workshop. We did it in Kenya together, Aquilas and me and a group of others, to actually think through whether a project was coherent at this stage. So, yeah, so risk. Okay, so are there any areas of risk that might cause harm or a problem? So, yeah, so we look at this group and there's one risk that the government's approach might be too charitable, right? So they might give out blankets at festival times to everybody with a disability, but their approach might not be rights-based. So that's a risk. So we need to make sure that the advocacy that the OPD and the project team are doing, those conversations that they're having with government, are messaging some of CBM's thinking about things like preconditions to inclusion, that people need accessible services, and that the government as duty bearers have obligations to take action. So we need to think, as we do our advocacy, the government, there's a risk that the government might just respond with handouts, but they have to take a rights-based approach. So that's important to think about. So there's also a risk that the government at district level might be very slow to make policy changes. And there's also a risk that we have an expectation that a lot's going to be achieved in, for example, a 3-year project. So we need to be realistic. So yeah, we should definitely try, but we realize that there's a risk that things might be slow and we don't want to raise expectations too much. But we're still going to put it in our theory of change, but we just recognize there's some risks here. There's also a risk that assistive technology might not be adequate, the stuff that's provided by government. So maybe we need to think about how do we connect with other NGOs who might be providing this sort of work. There might be other groups that we can link with that provide assistive technology rather than just relying on government. And there's another risk here, which is about community jealousy. For example, if we only support people with disabilities in livelihoods things, is that going to make other people in the community who are poor but don't have a disability a bit jealous? So, okay, so this might provoke quite a bit of discussion. And so this is something that we can't leave as just a mitigation thing. We have to change this. Okay, so here, this is where your theory of change. So we're going to change that one big risk. So we're going to change it so that vulnerable people with disability and the ultra poor are supported to include their livelihoods. So that means that we also have to change the higher level objective so that it's not just talking about people with disability. So that's the sort of thing that you can do. So if you address risk at this stage, there might be things that mean that you take a different approach and you add things in. For example, including more people who are poor but don't have a disability. But there's other things like the government giving out blankets. Well, you're still going to talk to government, but it's a risk that you're going to track. And so that goes into your risk matrix. So this brings your risk matrix to life with the real risks that you track as you are managing the process. So what you can see here is when you start to write your project design, you've already thought about a lot of the risks. So we're going on now to look at things like gender and disability. So these are important things to look at this stage as you go along. I might hand over to you, Aquilas. Give me a break.
Thank you, Julie. So our theory of change is coming up. So let's look at gender now. So we are not waiting until we are sitting at our desks writing our project design before we start to think about gender. So gender, so for example, how do we make sure that women join and are active in OPDs so that might be something in terms of our gender approach that we have to think about as we run the project. How do we make sure that women with disability benefit from the livelihood work, and what will stop them getting involved? The other thing is women are often carers for children with disability. So is the livelihood work that we are giving them appropriate for them as well? So these are gender issues that we need to think about as we approach the project. How do we make sure that if the project enable people to get increased income, how do we make sure that that benefits women and not just men? So this will provoke discussions around your approaches to gender. It might require that you do some more digging, some more analysis about what works in a particular community that you are working in. So this should be like a gender analysis.
Okay, so you've used your theory of change to think about risk, assumptions, gender. Now you can go on and think about disability inclusion. What about disability inclusion? So how do you make sure that people with more severe impairments are involved in the OPDs and not just the carers? Something that we find in a lot of projects. What strategies do we need to take there? Do partners and, for example, the partner staff, do they understand about disability rights, the rights-based approach, disability conventions? We're making some assumptions here. So is there understanding rights-based? Does CBM need to do a bit more training with those partner staff, like around preconditions for inclusion, rights-based approach, things like that? So do we need to put in some more training here? Do partner staff have the skills to support people in livelihoods, people who have more severe impairment? And how do we make sure that those approaches are addressed and monitored in the project? So we might have to, for example, make sure that there's some budget lines for training of partner staff in disability rights and conventions, or even some technical support to show partner staff how even people with some more severe impairment can get involved in livelihood works, like some occupational therapy input, so that the livelihoods work doesn't just focus on carers. So these are the sort of things that you can look at as part of a disability look at your theory of change. So another one would be, how do you make sure that those who are most in need of assistive devices and social protection get it, and not just kind of the easy ones?
Thank you. So what about safeguarding? So safeguarding is a big thing. So are children safe while parents are being trained or while they're running new businesses? Are people with disabilities safe? If you send them off to, let's say, a vocational training course with other people without disabilities, are they safe? Are they going to be exposed to any harm? Safeguarding requires more specific looks when you get to planning your activities, but good to have it thought about here when the approach to the project is still being thought out. So it's really important to think about safeguarding here. Now let's think about sustainability, which is also one important thing. So again, see, you are not just thinking about sustainability when you come to fill in the project form. You are thinking about it right from the start. Will the OPD continue?
For example, often we find that that an OPD might get a lot of support for 3 years, the project finishes and the OPD falls apart again. So will the OPD continue to work if the project ceases after 3 years? Things like, and what are you going to do about that? How are you going to make sure? The other thing is, oh, now I've lost. Yeah. So
Will
the other thing is,
yeah,
is what happens if a new mayor comes in and is elected? Is everything going to fall away that you've done? Markets going to continue to be accessible even after the project finishes? Are people going to continue to benefit from new livelihoods and training? Don't start setting up structures that you know are not going to last without loads of attention or money, which you can't provide.
Okay, so that's the value of a theory of change in interrogating your project, and it's a useful thing to do with a small group. And you need to use these questions when the project team have annual reflections. How are we going to manage? How are we doing managing those risks? Are our approaches to gender working? Do we need to change anything after 1 year? Don't just do this and file it away until an evaluator asks for it after 3 years. Use it for reflections with the implementing team as you go along. You'll have to be changing activities, approaches, and targets. So this is a good thing to reference. Okay, you've finished your theory of change. Hooray. Now it's time to think more about moving that into a project log frame, which is also a theory of change, but it's more operationalized. It's more detailed around activities, budget, about targeting, indicators that measures what you've achieved.
Yeah, one thing to note is that that some CBM country teams are doing more integrated programs, what they call integrated programs, that might have a component of eye health, livelihoods, mental health, disaster risk reduction, or disaster risk management. So in this case, you wouldn't do a theory of change, just one theory of change. You'd have to, because that would be too generalized. So you might do an eye health theory of change, a mental health one, DRR one, but then you have to have a more programmatic look at how the different initiatives are going to work together, and particularly be asking questions like, how are the different areas of work complementing each other? How are there risks of being, for example, spread too thin? Or are you trying to talk to the same government people about too many issues and really confusing them? How are you going to coordinate effectively, both operationally, how are you going to manage who goes into what communities and when, but also your big picture messaging to communities so that they understand what's being trying to be achieved. So this is really important to do a reality check around this in this thing that people are calling an integrated program.
Yep. So that's what you need to do now. So that's what you need to do now is take the main areas of your theory of change and step back and say, so this is the change that we want to see. What packages of work do we need to undertake during this project to deliver this change? It looks like we have two areas. So the first area is about stronger disability movement in West District, and the other one is about supporting people to move out of economic poverty. So essentially, there are two specific objectives that the project will have. One about disability strengthening and influencing, and the other about poverty reduction.
All right, I think, Aquilus, it's probably worth just doing a quick recap on the terms that CBM-Global use in their log frame. So they use we use overall objective. So you won't achieve your overall objective, but you contribute to it. So an overall objective is an intended or sustainable long-term or widespread effect of your project or program. The project will contribute to the realization of this objective, but it won't be done with the project alone. It's kind of like the big picture.
Yeah, so we also use specific objectives. So the specific objective is the intended change in the lives of identified group of people that occurs as a direct result of a project or program. This is the change that the project is accountable for delivering. The specific objective can refer to a change in state of a group of people, for example, their economic or social situation, or the performance of an organization. So we have two of these in our project.
Okay, and then results. So results are the change in an individual, a group, an organization's skills, knowledge, attitudes, practices that is needed in order to achieve that specific objective.
And we also have activities which describe the packages of work that will be carried out to achieve the results. For example, run a media campaign or support women to get vocational training. So activities can be made up of ranges of smaller tasks: identify women, organize the training providers, organize transport, etc.
Okay, so they're the CBM terms.
Yeah.
Okay, so we have our objectives. So then we can start to write those as result areas. So rather than writing helping the OPD to become stronger, you write it as a result, which is something like the OPD is a strong local advocate for change. That's the result that you want at the end of the project, at the end of 3 years. And another result is district and local government will provide ongoing rights-based support to disability. Result 3 is people with disability are more involved in community life. And then the other result is vulnerable people with and without disability have improved income. So they're the results that you want. The specific objectives that you've got here, they're already written as objectives. So you want stronger disability action in West District and vulnerable people having more economic security. And then the overarching objective is that vulnerable people have a better quality of life. And of course, you can debate these and wordsmith these, but what we're showing you is kind of the process that you need to use.
Yep. So it's useful for now to get support, to have some input into the technical aspects of the project. So are there any things that you or your partner does not have expertise? You want specific technical input now. What are good practice? What are things to avoid? Do we know enough about this to be able to plan and budget and have a good approach? So get the technical input now. There's no point writing a project design before you send it off for somebody to look at. And then you can start to develop log frame like this and start to develop those activities around each of the specific result areas. Remember, not everything starts from the start of the first month. You might start working on result area 1 and not start working on result area 2 until 6 months in. Then you need to be thinking about the budget.
So involve your partner finance team and your country finance team and your operational people as you help to develop those budgets, because they're usually pretty good and fast about doing those sort of things. Be realistic and don't blow out the budget. Stick to the budget of what's been approved.
From there, you should start to think about indicators. what will measure your success? What are the possible indicators? You've already thought about the possible risks. Put them in here. And there is also a fuller risk matrix later on.
So maybe you've got a small team that's starting to develop up this project, maybe 5 or 6 people. And one of the things that we like to do at this point is to give everybody a bit of paper and a pen and then say, okay, grab a pen. It's 4 years from now. The project that we've just designed has just finished and it's been a total failure. It hasn't gone well. Okay, now I want everybody to write down what's gone wrong and why. So it's kind of a fun exercise, but it helps to get people thinking about some of the things that might have gone wrong in this project that maybe they don't want to say in a big group. And what we found is that this is quite useful because it helps to surface some of the concerns that people might have that they don't want to raise openly. So you give people 10 minutes to write things down and then people read them out. And when we've done it, we've found that often there's common things that people raise, and it shows that there's things that people feel a bit nervous about, or there's some of the risks that they have to address, or particularly things about sustainability. So it really highlights some factors that you then go back and you think, okay, how can we address some of those things that could go wrong right at the start? For example, issues with targeting the wrong people, or the project being too ambitious or expecting too much. So it's a really useful way to get people reflecting, going back and refining things.
So with activities, as I said, be realistic about what you can achieve, and to remember to factor in things like budget for accessibility and reasonable accommodation, and any other activities that were identified in the partner capacity assessment about capacity strengthening of a partner that CBM has committed to do. Make sure there's a budget for safeguarding mitigations. Also ensure there's money for evaluation and reviews.
And then you might want to go back and think more about things like disability and inclusion. So this might be deepening the questions that you did in the theory of change, or in that exercise about what are some of the failures. So you're thinking about some of the tactics and activities that you need to do to ensure meaningful engagement, so that it doesn't just become a kind of a tick box exercise for participation. So for example, ask yourself, how are people with a variety of impairments going to be involved in the project? You could be asking, how do you make sure that those unrepresented groups, or those hard to get to groups, are really going to be involved?
Similarly, with gender questions, how are people of all gender going to be in? How are they going to be engaged? And how are they going to benefit from the project? You could also ask what activities, or is there anything we are going to have to do specifically to make sure a certain gender group or more are involved and are able to participate. So
Yeah.
for example,
So for example, LGBTQI people, or fathers who often are not the main carer for a child with disability, and so they often get overlooked in rehab training. So things like that.
Yeah, then if you are doing projects that have a specific environmental component, such as water supply and sanitation projects, or perhaps things that involve hospital waste, you need to think about the environmental impact that need to be addressed.
Risk. So often what we see in a risk matrix or a risk analysis that the main risks to the project are these three things: elections, rain, and staff turnover. Let's try and do better than this when we talk about risks. Inflation's the other one. So really think about what are the real risks of the project. So in this project that we've talked about, one of the risks, competing demands on government budget means that social protection reform might not happen. A focus on training carers might mean that people with more severe impairment are not included. Access to transport for markets might prevent the sale of goods. So they're the real risks of the project, not rainy season, elections. Yeah, they're risks, but they're not the big risk. And often a management team or a donor will look much more positively on a project that is really reflective about the real risks in a project. I think people often hesitate to talk about the real risks in a project because they feel it shows weakness. Well, it doesn't. It shows you being realistic. We know that the work that we do is working in difficult contexts. So let's be realistic about saying what the risks are. You're still going to get funded because you talk about the real risks. So use the risk matrix, including the safeguarding risk matrix, to really look at what those risks are. And then, don't, like the theory of change, don't just file it away. Bring it out every 6 months or so at your annual reflection and update it as you go along. The risks should change as you go along.
And then project indicators, not too many, not too few. Use the CBM-Global Impact Indicator menu and draw from those. Think about how realistic it is to measure them. So don't just put on the partner a whole lot of indicators that they will find impossible to collect.
Yeah, and don't let member teams or technical teams push a whole lot of unrealistic indicators either, because, and particularly when there's not a specific M&E person in the project team.
Yeah, and think about things like disaggregation. You should disaggregate indicators by gender at the very least, and with or without disability. But do you want more than that? Remember, you will later develop a more detailed monitoring, evaluation, and learning plan. You can use this schedule when you will collect data for each indicator.
Some project teams make it the mistake of thinking they have to report on every indicator every quarter. No, wrong. Sometimes you might only report on an indicator at the end of every year, for example. So some work for some result areas might not even start until year 2. So you might only have an indicator that you report on once at the end of year 2 and once at the end of year 3. That's twice in the project, not every quarter. So don't forget to put some time aside once the project kicks off to really unpack what the monitoring plan is for the project.
Setting targets is often hard.
Yep.
Don't be too ambitious. Don't go too high. Don't go too low either. Be prepared to adjust and change as you go. Also, if you find as you go along that the indicators just impossible to measure, then have a discussion with the partner about changing them.
Yeah, and this is what you should be doing in an annual reflection. You should be looking at your achievements, your targets, your budget, and adjusting as you go. It's almost like a project design that doesn't change while it's being implemented probably indicates a project team that's not thinking. So be prepared for changes and be prepared to have opportunities where your staff team can reflect on what needs to change in the project.
From here, you're ready to complete that detailed project design. We hope that this has been useful in stepping out how you move from wide consultations to refining and making decisions about what you can actually do. Developing a theory of change and using this to think through a range of issues. This helps to give your project design the rigor it needs. Now, you have all the information to begin writing the actual project design document.
So in the next presentation, we'll give you some tips and tricks on how to do that. Bye for now.
Bye.